Colorado, the number of COVID-19 cases continue to grow as fatigue begins to set in. 9Health expert Dr. Payal Kohli looked through the data and is here to help us understand those numbers. Good morning, Dr. Kohli. So what can you tell us about the new daily cases in Colorado?
Good morning, Natasha. So, for the last week in the United States, we've been having about 70,000 new cases every day. And yesterday in Colorado, we broke all our records. We had over 2,000 new cases in a single day. And just to give you a little bit of perspective, back in August, we were having about 2,000 cases in a single week. And back in April, when we were at the worst of our pandemic, we were still under 1,000 new cases a day. So I think this picture really speaks 1,000 words, and you can see our cases have just skyrocketed in the last week or so. And what I'm really concerned about is that this represents what we call exponential spread. And we're standing at the precipice of exponential spread. So we've gone from growing very slowly to suddenly skyrocketing. And that means that if we continue along this trajectory for the next few weeks, we really are going to have to deploy that nuclear option of doing a lockdown again, much as we don't want to.
Yeah, and we've seen a steady upward climb in the state's positivity rate as well, but some say that we are still way below our peak of 25.8% in April. Do you find that encouraging?
I'm so glad you asked, because the numbers by themselves can be misleading and you really have to put them into context. So you're absolutely right. If you look at the red curve here, this tells you about the positivity rate. But look in the background, because that tells you how many tests we were doing. So back in April, when we had a 25% positivity rate, we were doing almost no tests at all. And that was the reason for that positivity rate. But now, despite doing more tests than we've ever done in the entire pandemic, our positivity rate is climbing, which really tells us that the control of the virus has gotten very poor. Also back in April, Natasha, the virus was mostly confined to nursing homes and facilities such as that, whereas now we really do have widespread community spread. So I think we're in a worse place now than we were back in April.
And CDPHE also released a modeling report over the weekend using real world data from Colorado. What are the highlights of that report?
Yeah, they did. And the advantage of this report here is really it takes out a lot of the assumptions, because they're actually putting inputs into the model that are based on our behavior. And they found some very interesting things. So basically, 1 out of every 292 Coloradans is currently infectious. And basically, they're expecting that every infectious person is going to spread it to at least 1.5 other people, so that R0 or reproductive index has gone substantially up compared to what it was before. And this means that by mid-November, we're going to be exceeding the peak of hospitalizations that we had in April. And that means we'll basically have more than 900 people in the hospital, which is really going to start to spread our resources very thin. And interestingly, and not surprisingly, they also found that the transmission control was really the worst in the youngest population, those aged 20 to 39 years, with only about a little above half of them actually effectively controlling the spread of the virus, even when they're infected.
Dr. Kohli, thanks so much for going through that number. Hopefully we can, curb the spread or something. Appreciate it.